Hello, Jim Jordan here.
Hello, Congressman. This is Abby Bemis with Erie County Economic Development. Thank you for joining us. Glad to see us.
You bet, Abby. Thank you.
We are going to get started here, and I will kick us off. We have one or two more joining us.
How many are going to be on the call, Abby?
We have 60 participants currently, but I'd expect that to rise a little bit as we get past noon.
Okay, thank you.
Thank you. And on the 419 number joining us via phone?
Dee Knapp with Congressman Jordan's office.
Oh, very good. Thanks for having us. All right. Well, good afternoon to all attendees and our panelists. My name is Abby Bemis. I'm the director of the Erie County Economic Development Corporation. I think I've had a chance to talk with many of you over the last couple of weeks, so hopefully a familiar face, but I hope everyone is well. Happy Friday. I hope this warm weather. Today's agenda, as usual, we'll make a few comments about what we've seen change since our last webinar session. Honored to have U.S. Congressman Jim Jordan's office on the line for updates from D.C. Also going to hear from some of Ohio's advisory groups. Those are business representatives, fortunate to have some local representatives on the state advisory groups guiding best practices for reopening a business in Ohio. And then, as always, we will have an update from Abby Schwanger with the Erie County Health Department. So from our end, since you heard from Sarah Ross, our program manager last week, I suppose 2 weeks ago, pleased to see many new reopening dates set for businesses in Ohio. The report from Columbus is that with the dates announced, that we'll have at least 90% of our economy operating. I have those listed there, and I'm sure Abby will make some comments to those dates and guidance as well. You know, from our perspective, there's a lot to be managing. We know in terms of operations and new guidelines. Keep in mind, you know, your customer communication and communication to organizations like the ones you see at the bottom of your screen. I know all of us are here to help you and to provide your news to potential customers in the region. So I would encourage you to stay connected. Sarah Ross, that you've met the last couple of weeks with our program, the Regional Incubator for Sustainability and Entrepreneurship, has been hosting a lot of one-on-ones with small businesses as they try to sort through new strategies for reopening. And we do have 4 of those one-on-one sessions available on Tuesday the 19th. So chat in if you would like to participate in one of those sessions. Also wanted to make a note that Ohio has opened a new rebate program for those in our food and beverage space as you are restocking your restaurants and bars. There is a one-time $500 liquor rebate program being made available. Every dollar counts, so wanted to make sure that we could pass that along. Also noted here, pandemic unemployment assistance is now available for application in Ohio, as is the payroll protection program still rolling, and they have updated some guidance. And we're still waiting for forgiveness guidance on that program, but if you've not taken a look at it, still strongly encourage you to do so. And Congressman Jordan may make a note of that as well. One thing that you may have caught related to the payroll protection program, talked about a lot in the news the last couple of weeks, is how you will be certifying hardship for those of you that accepted that loan program in order to be forgiven. There was a note that your business needed to have experienced hardship. There was some clarification on that from the U.S. Treasury and the SBA that any payroll, any loan principal under $2 million is automatically qualified and has demonstrated that hardship. Just an understanding of how widespread the impact of this pandemic and economic fallout has been. So most likely you are in touch with your banker. Stay in touch with your banker to get more guidance if you have accepted that loan program. And that is all from my end. I want to provide the majority of the time to our participants on today's call. So first up, we have U.S. Congressman Jim Jordan. I want to remind participants that there is a chat function available on your screen and a Q&A function. We would direct you to the Q&A on your menu bar to send in questions for the Congressman. And with that, let me try to hand over to Congressman Jordan.
Abby, thank you so much. Thanks for all the work you're doing, and for everyone on the call, to our frontline healthcare workers and health commissioners, and we appreciate we just appreciate everyone's effort during this difficult time. As was mentioned, you know, obviously the PPP program has been very successful and very popular, as you can expect. When government, because of this health crisis, tells people they can't engage in their livelihood, can't operate their business, then government has to compensate. We view this as a fundamental constitutional principle, comparable to a takings issue, where if the government's going to take someone's property for eminent domain, as an example, then you have to compensate. And this was the same kind of a similar situation we were in. So that's why you saw such widespread bipartisan support for this concept. Conservatives supporting it and passing it. Some of the clarification on your certification for this, the SBA made clear just 2 days ago that anything less than $2 million, which was mentioned by Abby earlier, anything less than $2 million is deemed to have met the certification requirement concerning your getting the loan in good faith. There's still some question about clear language on defining what exactly for people above $2 million who applied for the loans, whether they had other credit options or what have you, and whether you may have to give the dollars back. Now that's been extended till next Monday, as you all probably know. Our office has been working with business owners around the district for the last several weeks. It seems like around the clock. So I know we have Dee Dee and Carolyn on the call, and they may have worked with many of you already. But do not hesitate. Any question you have, we've been talking with SBA, talking with Treasury. I had talked with Steve Shabbat, who's the top Republican on the Small Business Committee, trying to get as much clarification as we can to give that information to business owners, small business owners, families, and their legal counsel, as give it to their legal counsel as well. Make sure everyone has as much information they can to make decisions. The next thing, there's a bill. I'm in Washington right now. We're going to be voting later this afternoon on this $3 trillion package the Democrats have put together. I think it's a bad piece of legislation. I think the best phase 4, the best stimulus now, is to simply get back to work. And as was mentioned earlier as well, it is good to see Ohio doing that. Frankly, I wish it would be moving in at a slightly faster clip, but we're getting there, and that to me is the best news. Is that the best thing we can do for our economy? Secretary Mnuchin said this on Monday. He says if we don't get back to work soon, there may not be this economy there that was so robust, so strong, unprecedented numbers prior to the pandemic. We need to get back to work, and so we've been encouraging that and pushing for that all the way through. Finally, I am nervous about the other issue that's going to be voted on today on the House floor. It'll be a completely partisan vote, unfortunately, because the Speaker of the House is actually going to change the way the House has operated now for 200 plus years, and going to allow what's called proxy voting. And this legislation is very dangerous. Fundamentally changes just changes the country, changes how the Congress has operated through all kinds of difficult times in our history. But now they're saying that you can give your vote to another member and they can go vote for you. And actually it says one member can have 10 proxies. In other words, 10 people can tell one member how they want to vote. That member can be on the House floor with 10 votes in their back pocket and conduct the business of the American people. This is extremely dangerous, and again, unprecedented. And maybe most importantly, or I think actually most importantly, it's unconstitutional. The Supreme Court has ruled that you have to be present to vote, and present means you can't redefine what present is. Present means being in the chamber, at the seat of government, doing your duty as an elected representative of the people in your respective district. So I'm very nervous about that. I've spoken out strongly against it and just spoke out against it here a few minutes ago, or actually a few hours ago on the House floor. So with that, maybe it's best, I'll be happy to take questions if that's what you want. But I appreciate, again, all you're doing. And like I say, if you got any questions about the Paycheck Protection Program or anything else, never hesitate to contact Dee Dee and Carolyn in our office. They do a great job working on behalf of all of you. And with that, I'll yield back the time.
Very good. Thank you again, Congressman Jordan. From our perspective, this is not an easy problem to solve. And we appreciate the swift action that your office and our administration all have taken to support businesses in a trying time. So I want to remind participants, you can chat in any questions. We do have a few that have been sent. I would direct you, Congressman Jordan. One question here was whether there is any consideration or chance that the PPP program extended to 501c6 organizations, such as commerce.
It's not going to happen this week. There's talk about that very issue. The Democrats may have that in this bill, along with all the other things they got in this legislation, like allowing illegal aliens to illegal immigrants to get access to the same stimulus dollars and that are there for citizens. They have things in this bill like mandating that certain criminals all be released from prison, and a host of other left-wing things. So while there may be a few good things in the legislation, there's all this bad and all this spending and everything else. And our attitude is let's let the $3 trillion that's already been appropriated and already been spent. Let's let that work first. But that issue has been discussed. We'll see if in the future there's some way that it can actually happen.
Very good. Thank you for that clarification. Some additional questions related to the PPP. Or a suggestion for your perspective. There is a question about whether, since the PPP second round funding has not been expended yet, whether that money could be rolled into the Economic Injury Disaster Loan Program and whether that might be an option for businesses.
Yeah, I mean, look, the EIDL program and the PPP, I'm not sure if that's going to happen. There hasn't been, I've not seen a focus on that. The main concern has been what we've discussed here already is, people who in good faith applied and received the funds and then were told after the fact, oh, if you had the opportunity to get financing from some other, institution, some other means, then you may have to return the dollars, and that's been the uneasiness. So the focus has been there, not so much on how we could also access and change the EIDL program, the economic impact. I just called it EIDL. So yeah, but that's been the focus. The focus has been on making sure the PPP program is working the way it's supposed to be, and that people who are eligible are able to retain those funds.
Very good. And one last question here on the PPP. Any comments on tax treatment of that program and what Congress is?
We're trying to get answers to that too, and clarification there, because I know that has been raised. And so I would encourage anyone to work with our office. We're trying to be able to give clear and concise information on the tax implications and potential liabilities for people who access the dollars.
Very good. And switching gears a little bit, we were curious if you could provide some commentary on limiting company liability as more and more businesses opening across the country, guidance or other best practices.
Wait, I didn't catch that, Abby. Can you say that again?
Yes. We have a question here on wondering your thoughts on how to best limit companies' liabilities as more businesses are opening.
Oh, liability. Sure. No, look, this is something, I had a conversation with Senator McConnell a few weeks ago. He is committed to getting any future bipartisan legislation that is put together. The Senate Majority Leader is committed to having some liability language, because I have the privilege of being the top Republican on the House Judiciary Committee. We are working with the Senate Judiciary folks, with Leader McConnell's office, and frankly the White House, on trying to put together the language that we think will allow businesses to open and not have this cloud hanging over their heads and trial lawyers trying to shake everybody down. So we're working on that. It would you know, the reasonable person standard on negligence is there's a look to make that just a higher standard, so that there's real protection there for people who are operating in good faith, want to open up their business and get the economy moving again. So that is something we are working on very closely with our colleagues, and trying to get into any future bipartisan, and I stress that, bipartisan bill that may get passed.
Thank you, and appreciate your work on that. Of course, being in economic development, very interested in jumpstarting our economy, so appreciate the foresight on issues that might prevent our success in doing so. I see that we have addressed most questions from our audience here, but Congressman, are there any closing comments you'd like to offer to the group?
No, that's perfect timing, because I got to run to another event here. But I look forward to when we get back to normal, getting up and seeing you all in person. This is no one likes this idea that we got to do everything on conference calls. But thank you again for the difference you make in our communities over these last, well, not just over these last 8 weeks, but all the time. We certainly appreciate it. As I've said a couple of times, our Norwalk office is 419-663-1426. If you need to touch base with Dee Dee or Carolyn, you know, make sure you don't hesitate to call. And everyone have a great weekend. And if I don't get a chance to visit with you on the phone or beforehand, have a great Memorial Day weekend coming up. God bless y'all. Thanks.
Thank you, Congressman. And to participants, we will chat in that phone number shared here. I would echo, yes, a great resource and office here locally. Thank you to Carolyn and their team for setting up this time, and us benefiting from the time of Congressman Jordan. So with that, shifting gears here a little bit, as always, our goal with these sessions is to address issues that are top of mind for you all as business owners. And as we were putting together the agenda and thinking about what is left for our economy to get back functioning as close to normal as we possibly can, there are still some segments of our economy that don't have a reopen date or necessarily guidelines published yet. And we're fortunate to have some local team members working to address when those things might occur and how and what that business function might look like once it's reopened. So handing it over to members of Ohio's advisory group committees that are working on that. First up, I was going to pass it to Larry Fletcher, who is serving on the advisory group for travel and tourism, obviously very important to our region here in the Lake Erie Shores and Islands. Larry?
That's an understatement. But yeah, good, is it afternoon? Yes, good afternoon, everyone. Good to talk to you again. Look forward to seeing more of you in person. One of the other people on this call, I actually was in an in-person meeting with this morning, appropriately distanced with our masks, and it was, I mean, it was good, and it was good to see people in person. So we'll be getting to more of that, I think, as we move forward. So I had the honor to be selected for one of the advisory committees, the Travel and Tourism Advisory Committee. This was a group that was charged with evaluating proposed policies and procedures for getting, ticketed attractions open, everything from the Cedar Points and the Kalaharis and those types of major businesses to small museums, historic sites, and really everything in between. The other members of the committee, and these were people picked not to represent necessarily their geographic region or the businesses in their region, but to have a cross-section of people from across the state that represented, different segments of our travel and tourism industry. So some of the others on it was a 15-person committee that also included, additionally included people from the state health department and local health departments. Our committee had Nancy Osborne, the director of the Ottawa County Health Department, and a gentleman from Hocking Hills area, the health department down there in that county. But some of the other ones on it were the Visitors Bureau directors from Cleveland, Columbus, Cincinnati, director of the Columbus Zoo, director of the Columbus Convention Center, the woman that owns and operates the Hocking Hills Canopy Tours. So, quite a diversity. Cuyahoga Valley Scenic Railroad. There was a charter captain on that group. A motor coach operator, a company that owns a fleet of motor coaches, which is for this area certainly a big component of our industry, and two representatives from Cedar Fair, Leah Lexicos and Duff Milkey, were also part of that group, recognizing their footprint not only here but in other parts of the state and country. And they split us up into subcommittees to work as efficiently and quickly as possible, because we first met last week on Wednesday, and our draft was done a week later. And we met, we had 4 calls during 5 days, and then several email sessions back and forth. So our draft, as far as I know, is in the hands of the administration. There may be some questions, so we were asked to kind of stand by in case we were to be brought back together to answer any questions. But otherwise, although it wasn't mentioned to us when these announcements would be made, the way things have been going with some of these other advisory committees is it probably won't be too long. I'm hopeful that maybe next week we will hear something about an opening date for some of these other places. My process in this, realizing I was representing an entire industry, and I reached out to some of my friends that represented segments of travel and tourism that weren't necessarily sitting on the committee. So I could, for example, with water parks, learn about what their challenges would be, what things they thought would work, what might not work, so I could incorporate those into my thought process. We also talked a lot, the Visitors Bureau directors, other bureau directors, and I talked with our counterparts from around the state to make sure we weren't missing any type of business that we would want to consider in our conversation. Our language, much like the restaurant order and other orders, did contain a lot of phrasing like as possible, where applicable, those kind of things, because we know that we need to build some flexibility into this. There are certain things that will work very well for one type of business and simply not for another. So we wanted to make sure that there was adequate flexibility in there. But a lot of the language that dealt with the safety and the disinfection and the cleanliness and all those types of things was pulled in most cases word for word out of other orders that had already been approved. So we didn't have to reinvent the wheel there. And that really helped move the ball forward. So that's, that's in a nutshell how that process worked. And again, we're hopeful that we'll see something in the terms of an announcement within a week. Then the part that, is the more challenging part, I think, is the sometimes different interpretations of the language as we go, in different parts of the region and around the state. So that's where I've been, pleased to see and will continue to advocate for this partnership to occur between our business owners and the local health department as we start to see things open up, so we can all work together to create the safest experience possible and sustainable business operations. So I'll leave it there and answer any questions now or later if anyone has any.
Larry, thank you. I'm 100% confident that you've represented our region well, and we're excited to see all these recent announcements and developments and getting our Lake Erie shores and islands up and thriving. I saw Kelly's Island and Put-in Bay are getting started with some business this coming weekend, so that's exciting. We do have 2 questions that I'll send your way if you're able to comment on it. You know, if festivals are included in the conversation around travel and tourism.
Yes, I know that they were not part of our discussion. There is another group looking at those large types of gatherings. It's my understanding that it's in the fair group. If you go to the state's website, you can find a list of all of the varied advisory groups and the members of those groups. And there's a fairs group that is talking of, I asked this question a couple days ago when getting some calls about festivals, and some folks at the state level told me that the fairs group is working on that.
Thanks, Larry. That's very helpful. And we will try to chat into the group that link for accessing the advisory groups list. And as a reminder, you have various representatives locally for your governor's office. He might also be able to direct questions and concerns to you. How about tour buses, Larry? Was that a topic that came up with your committee?
Yes, there was a representative from a company called Coach USA. They had us broken up into subcommittees. One for outdoor ticketed venues, places that had indoor-outdoor spaces like a zoo, for example, and conferences and conventions. The motor coach representative was on the conference convention committee, so I was not on that one, so I didn't interact with her directly. But in our meetings with everyone, she referenced protocols that they already had in place to certainly provide as clean, disinfected. Those are protocols that these companies already had in place, and they're just ramping them up. And then the masks, and then socially distancing parties on the motor coach as one way to look at how they could continue to do that. So yes.
Very good. Thank you. So we can expect to see some guidance on some of the recommendations that have been sent up the chain in relation to that. Getting some questions here related probably more to the large venue group, Cedar Fair and Cedar Point and opening days. I know their organization has put out some things on social media. Anything else you'd care to comment on, Larry, in relation to when we might see some of our bigger attractions be opening in the region? I know I wouldn't venture a guess, so we'll see.
Well, I think the group that our group included those venues, and so I would expect that the announcement will include those venues when that comes. And even though I haven't been told this, I'm hopeful that we'll hear that announcement next week. Then there's the ramp up time that it takes once a business knows what the date is, how much time it takes them to get prepared. But I know that those places, especially, although I've seen examples of extremely comprehensive plans from the biggest destinations down to a small museum on how they're going to be handling the processes. So I know those plans are incredibly well done, so they'll be able to move pretty quickly once they get the green light.
Thank you, Larry. Yeah, I know. So Larry and Larry is one of our board members at Erie County Economic Development, and as is Jason McClure, the general manager at Cedar Point. And we were discussing just last week the many-page document that has been put together to keep people safe at that sort of establishment.
Like 400.
400 specifically.
400, which I'm sure is an indication of how well they've thought things out. And the director of the Columbus Zoo was the chair of the subcommittee I was on, and he sent us all his plan for the zoo, and it's incredible how I mean, you might think that a place like that would not be possible to do the things that you need to do, but it is. And when you look at the Columbus Zoo's plan, for example, and I'm sure with Cedar Point's and the water parks, they've got this thought out. Although there is always going to be a component that it's going to be the responsibility of us, those who visit these places, just like if we choose to go into a grocery store now. I mean, we've got some responsibility here, and that's the other piece that I hope people do what they're supposed to do.
Thank you. Okay, Larry, really appreciate the insight. Thank you for representing our region so well. We may also have Jeff Hoffman on the line here. Bear with me, folks, and possibly some technical difficulties here. Jeff, if you are on the line via phone, if you could use the hand raise function to let me know that that is you, or chat in which number to unmute. You are not automatically unmuted as a participant on the line. So I won't hold us up waiting for that, but Jeff, if you are on and want to send us a message so that you could add some comments from the outdoor recreation group, please do so. And in the meantime, let me hand it over to Abby Schwanger with the Health Department. Larry, thanks again. And I know you have a meeting to run to, so we won't take it personally. And if we get any more questions, we'll direct them your way. Do you want to chat into attendees, Larry, your contact information in case they have anything they want to direct to you for feedback?
I will, and I don't have to leave. I had my webinars mixed up. It was the other one was before this.
Oh, perfect. Well,
so for a while I was on both of them. I somehow pulled that off.
We are all getting technically adept in the COVID challenge. That's for sure. Okay.
My contact info in here.
Okay. Abby, would you like to share your screen? I will stop share.
Yes.
All yours.
All right. Can you see it now? Okay. Great. So again, I'm Abby Schwanger, and I'm the Public Information Officer and the Director of Community Health at the Erie County Health Department. And so I just want to give you another update. You guys are all, I'm sure, used to my updates by now. As of this morning, we have 87 laboratory confirmed cases of COVID-19 in Erie County. So we're seeing a little spike here. We had held steady for a couple days this week, and then we got actually 6 new laboratory confirmed tests this morning. And so we are looking at another little spike, and you'll probably be hearing a little bit more about that in the next couple of days. And so with 6 probable cases, we're looking at a total of 93 total cases in Erie County as of this moment, and that seems to change by the moment. We've had 20 total hospitalizations and 3 deaths, and we've been holding pretty steady on the deaths for a while now as well. And then the state numbers below, you can find those every day. You can find all this information on coviderieohio.com. It's updated at least twice a day, and so you can see these updated numbers. They're going to be the best way to get your information. I wanted to go through a little bit of the demographics and dig into the statistics a little bit, because I think people find it interesting. We had a little peak here in about mid-April, and then we're had another little peak early May, and then we're going to be looking here at another little peak now as this current situation is developing. But we've had, this was 81 total confirmed cases. So this data was actually from Wednesday when we released these statistics. And so the demographic breakdown of that, we're looking very, very disparately impacted people. African Americans are disproportionately represented in our positive COVID-19 cases. So almost 50% of our cases are African American. And then if you added the other is mostly individuals who are multiracial and African American. And so we're at over 50% of our cases are multiracial or African American, whereas the population in Erie County is only about 9% African American. So that's a very disproportionate representation in that community. It's something that we are looking more at and digging more into and trying to figure out what the reason for that is. And that's not just an Erie County problem, that's something that is common throughout the entire state of Ohio and the entire country, in fact. The sex is, we're skewing more towards the female side, 63% female, 37% male. The location of our cases, I'm sorry, this is a typo. It should be cases by zip code. And so the 44870, so the Sandusky area is very much highly represented, which makes sense. That's the bulk of our most populated area is the Sandusky-Perkins Township area. So almost 80% of our cases are in that area. About 25% have been hospitalized, 75% have not been hospitalized. And this is another interesting one. You know, you hear so much about how this disproportionately impacts older adults, but that's not necessarily what we're seeing in Erie County at this time. Right now, our most represented age group is in the 20 to 29 age group. So about 20% of our cases are in that 20 to 29 age group, and then distributed across that adult age group. One thing I really wanted to talk to everybody about today, to make you all aware of, as you all know, testing has been a huge issue in Ohio, in the United States. So there's been a major lack of testing, and that's not because we didn't want to test, there just aren't tests. But now that's changing, and that's tests are becoming more and more available. Funding for our agencies has become more and more available to purchase tests. And so now we are going to be doing some very, very broad testing coming up here soon. We're going to have more details coming out, but I want you to just be aware of it and keep your eyes open for this. Registration will begin on May 22nd, and then testing will be, dates are May 30th through June 6th. This is just the first round of testing that we're going to do. You'll be able to pick from 3 different testing locations. So you could come to the Erie County Health Department, you can go to Firelands Hospital, their main campus, or at Family Health Services on Hayes Avenue. And so those are the 3 testing locations. Right now, we're limiting it to 1,500 people, the first 1,500 individuals that register. And we will, again, be expanding that and offering more tests. Anybody who wants a test, I don't want to sound like this, but anybody who wants a test can get a test. We're going to have those all available for as many people as need them. And so the only real requirement is that you have to either live or work in Erie County. And those will be offered at no out-of-pocket cost. So if you have insurance, we'll bill your insurance. If you don't have insurance, it's on us. But there will be no costs for individuals who are getting tested. We're offering both types of tests. So you might have heard of PCR tests or antibody tests. So the PCR test, it actually tests whether or not you have the virus currently today. And then the antibody test will test whether you have ever had the virus. So perhaps you think that you had it back in February or March, but you were never able to get tested because they weren't available. Now we can test you with that antibody test and let you know if you potentially had the virus a couple of months ago. And so that could be very helpful information. So keep your eyes open for this as it becomes available. Again, registration will begin on May 22nd. You can go to coviderieohio.com, and that's where you'll be able to register for the testing. And again, we're working with Firelands Regional Health System and Family Health Services as a partnership on that project. As far as the Responsible Restart Ohio, getting businesses up and going, the Erie County Health Department is working really, really closely with all these business owners. There are way too many requirements and protocols that have been issued. I think Larry, talked about them a little bit. And so I'm not going to get into those now, but there are all kinds of guidelines and restrictions and really individualized information for all of these sectors. And so we are working very closely with all these businesses. Our sanitarians are out, they're hitting the pavement every single day. They're visiting, if they've already visited your business, and they'll probably be there again. And they're there to help. They're there to offer you the information. They're there to answer your questions. And we know that everybody, these are big changes, and we're all changing the way that we do business on a daily basis. And so we're there to provide that support, provide that guidance. And when I talked to our environmental health staff, the big thing that they really wanted me to share was a thank you, because they said all these business owners and managers have been so wonderful, and people really want to do the right thing. People really want to keep their employees safe. They really want to keep their customers and their clients safe. And so everybody has been very helpful and very willing to do whatever it takes. And I think that's a wonderful attitude to have, to just do whatever it takes to get business up and going again. We want to make sure our job is there to help keep everybody safe, to help provide you that guidance as we move forward into opening. And we're going to continue to be there. So you can always visit if you have questions. Our COVIDErieOhio.com page, if you click on the businesses tab, there's a lot of great information there. And we have all the individualized guidance for different sectors. And that's also where our dashboard is and where you'll be able to register for testing in the coming dates. So bookmark that website and keep coming back, because that's going to be a really great resource for you. And then also, if you have any questions, always feel free to call our COVID-19 Information Center. That is staffed from 8 a.m. to 6 p.m. 7 days a week. So call anytime and we will answer your questions. If you have specific questions about your business and how to open that up, we can answer those for you. We can put you in touch with the correct person. And if you have any complaints, we get a lot of complaints. And so if you want to report a business for not following, not that we're going to come and close the business down. That's not what we do. We go and we provide them the guidance, because we assume that if people aren't following the protocol, it's because they just don't know. And so, or maybe they haven't been able to find a way to make it work, and maybe we can help find a solution to make it work. So if you have a complaint, call us and we'll come and we'll help come up with a solution. So we're all on the same team, we're all in this together, and we're here for information and resources if you need us.
Awesome. Abby, as always, thank you. And I couldn't agree more. Appreciate the approach that your department is taking and really making this a partnership for everyone's success. So thanks to the whole team for that. You are getting a few questions in here that I wondered if we could answer for the benefit of the whole group.
Okay.
A few related to testing. One being, so if someone is ill, is that related to the testing that you outlined? I assume that will be a different
Yes,
channel.
and so anybody can get testing. And so if you have symptoms, you can get a test. If you don't have symptoms and you just want a test, you can get a test. If you think that you were sick in the past and you may have had it, you can get a test. There are two different types of tests, those PCR and antibody. So we can walk you through if you're not sure which type of test that you need, or we can do both tests. You can get both tests at the same time. So maybe, you're not sure, we'll do both. And so it's going to be, I think, really helpful to have that information for people either way.
Great. And I know you're representing, obviously, the Erie County Health Department today, but we have some participants on the line from perhaps Ottawa County or Huron County. Do you have to be a Sandusky resident to get a test, or what guidance would you provide for residents of other communities?
So for the testing, as of right now, you have to either live or work in Erie County. And so it's for folks that are here in Erie County. But, keep your eyes and ears open, because all of testing is ramping up everywhere. So we're getting ahead of the curve here and trying to get this up and running right away. But other communities are going to be implementing very similar things very soon. I'm certain of it.
Okay, so maybe check those social channels or get the number for those lines.
And yes, and also if you want antibody testing, you can have your Firelands Hospital is doing antibody testing. And so you just have to have a doctor's order. So if you have a primary care physician, you can call them, they can order an antibody test, and you can get that done through the hospital. This is just an extra way for us to reach more people.
Got it. Thank you. Helpful. And you mentioned this, I believe, but is there an age requirement for testing? Kids are welcome?
No, everyone.
Okay, great. And then related more to business operations, reopening hotel pools. I saw that there was some things from the governor's office on pools, but do you know when details on restrictions might be published for hotel pools?
So the pools, public pools, the date has been, they're allowed to open, just not water parks, so not like a Kalahari type place. But my understanding of it is that the hotel pool will be allowed to open on the date that's published, and I can't remember off the top of my head which date that was.
26, perhaps?
Yeah, that sounds right. But obviously, every single one of these sectors, every single one of these, types of businesses or locations is going to have to follow specific protocols and rules. And so, we'll be in contact about all of that information, providing that information to those owners.
Great, thank you. And related to the ever popular mask and face covering topic, are face shields the equivalent of cloth masks? Would
No.
they both fulfill?
No.
Okay.
So, using some sort of either cloth face covering or a medical type of mask we know that it's beneficial in preventing you from infecting others. And so it's not going to necessarily protect you if somebody else is coughing in your area from breathing that in, but if everybody is wearing a mask, it will prevent them from spreading it out to others. And so we know that businesses, they have to require all of their employees to wear masks. Of course, there's a list of about 6 different, loopholes and ways that you could not wear a mask. And in that case, then those folks are not required to wear a mask. Now, certainly if they wanted to or were able to wear a face shield instead of a mask, but only because they fit one of those criteria for not requiring a mask, then they could wear a face shield as an extra, in lieu of not wearing anything. They could wear a face shield, and it would provide some benefit as long as that it extends below the chin and it goes around the sides of the face. It will be better than nothing from spreading that virus, but we know that that's still going to be able to get out, around the sides of the face shield. And so, for generally speaking, the face shield does not replace a cloth mask. Everybody is still required unless they meet one of those criteria, in which case, if they are not required, then they could wear a face shield if that works for them instead.
Perfect. Thank you for that clarification. Let's see. Do you have a few more coming in here? Going back to testing, your doctor, if you have a Firelands doctor, for example, they would be able to order you a test regardless of where you live. That wouldn't necessarily be driven by residents.
Yes, and so that's all through Firelands Hospital. They would, bill your insurance and that sort of thing. So if you want a test at Firelands, you can have your physician order a test. You can do, either PCR or the antibody testing and get that done. I'm just speaking of this, this mass testing program that we have partnered with Firelands and Family Health Services to implement. That is just restricted to Erie County.
Got it. And you may not be able to address this, but I'll pass it along since it was asked. But there was a question about Ohio Veterans Home and whether there was an outbreak there. And then related, we're going to see more cases coming back as positive as testing ramps up. Any comment on what data people might want to pay attention to really have a better barometer on when to worry, when not to worry, etc.?
Yeah, so right now, I would not worry. I think that it's really important that we all continue to take the same precautions that we've been taking. We have to understand that the virus is still very much present in our community, and it's still very dangerous. And so you still need to be wearing a mask when you go out in public to prevent from spreading it and accidentally infecting somebody else in case you are sick and don't know it. And we need to continue practicing social distancing. My kids are still not going around my parents. If that's any indication, that's what we're doing in my house. We're still not eating out, and going places. Even though things are opening up, we're still only going to the grocery store once a week, one person, because we need to continue to practice those social distancing measures to reduce the risk of infection. It's still there. But now, what we've done by flattening the curve is we have given our healthcare system the ability to ramp up testing so that we can now test people, whereas we couldn't 2 months ago. Sorry, we didn't have tests. So now we can test people, we can do contact tracing. We have been able to expand our epidemiological staff who can do expanded contact tracing. We've been able to expand hospital capacity. Firelands has expanded. We have additional facilities over at the Jenna Cross Lutheran Home with another 50 beds that are available if we were to get a surge in cases. And I can't speak specifically about any institution. I know that all nursing home cases, they are reported every Wednesday by the Ohio Department of Health. And so those will be posted. If there are any in Erie County, they'll be posted every Wednesday. And so you can get those numbers there. But we're working with all of the nursing homes in Erie County. We have been since day one. We have been in contact with them. We have been working with them very closely, providing them information. And they've all been wonderful because they want to protect their residents and their staff as well. Just like all the businesses, they want to do the right thing. And so they've all been wonderful to work with. They've implemented all the appropriate measures, and they're continuing to do those measures. And as new measures come up and are recommended, they're implementing those as well. And so, that's where we are.
Perfect. I'm gonna pass you one more question, and then in the interest of time, we'll probably direct people to still send in your Q&A, because Abby usually sends me an email answering anything we didn't get to. So please know that they are always a resource at the number, or you can email both of us if we don't get to your question. But I saw something come through here twice. Oh, someone is looking for guidance on how schools should quarantine Chromebooks before handling them. And I'm going to generalize that perhaps to offices and just devices that are being transferred from one person to another. Any guidance on that?
Yeah, so really we encourage everyone in all businesses to limit the amount of contact and items that are being transferred back and forth. And so having, one device or one, item allocated to one person is going to be the best deal. As far as, do you want to how to disinfect them, or?
I'm making an assumption here, but
yeah,
what I know of my mom's teacher, I think they have to turn them back in. And how long do they need to sit alone? And
okay, so we know that the virus can live up to a couple of days on surfaces, and so it probably is best to let them sit for a week or so before you're using them. That's going to really ensure that the virus is dead if the virus is on any of those devices. And then I don't want to give you any advice. I wipe everything with alcohol all the time, but look at your user manual. I don't know. Everything will probably explode at some point here, but.
Good. All right. Thank you. And if we didn't address that question adequately, make sure you follow up with the phone number, but hopefully that provides some help to you. Abby, thank you. Really appreciate it as always. Reminder to the group, more questions and concerns, they are here as a resource for you, and we thank you for that, Abby.
Thanks for having me.
Thanks. Jeff, I see that we did have Jeff Hoffman jump on from Sandusky KOA, who represented our region for outdoor recreation with the state of Ohio. We had Larry join us earlier, Jeff, and give some comments from travel and tourism. And I saw that campgrounds have also recently published an open date, but just wondered if you might share a few comments on your experience from the advisory group and any heads up or things that other businesses on this line might be aware of from what you learned there.
As you know, Ohio has a diverse amount of outdoor recreation. We have beaches, we have public pools, day camps, islands, all kinds of things in the tourism market, and even the local markets that are trying to be open again. Everything is moving forward. We have protocols for campgrounds. We have protocols for the pools, which should be out. I have a preliminary copy of it that we're using. Day camps and some of the other things with children still aren't finalized. We're hoping by Monday that those are finalized. Biking, birding, all that is in the final stages of being open. So do look for the state parks to be open very shortly if they're not already. And most of the metro parks that have been closed because they couldn't social distance should be open. I will say that playgrounds, contact points still will not be open for quite a while, but to actually just get out and use the outdoors, we are getting to the point where that's going to be open. And I'm sorry I had this meeting scheduled for 1 o'clock. I thought I was checking in early.
Oh, well,
Somehow it got
you're a
confused.
grand finale, Jeff. So to those on the line here, if you have any more questions, feel free to chat them in. Jeff offered quite a few guidance points on upcoming dates and things to anticipate for your own outdoor business, but I'm sure he would welcome any questions or further comments to the chat function.
Is a panelist allowed to answer a question?
You
Ask
certainly
a question, I mean?
Certainly.
Hi, Jeff. So your group talked about beaches, like public beaches, not a private beach, not necessarily a state park beach, but
Pretty much all beaches, what we're trying to do is make sure that we're consistent across the board. Public and private are all going under the same rules so that nobody feels discriminated against.
the only reason I ask, and it won't be the first time there's been crossover with some of these committees, but I was thinking about our partners in this region that have private beaches, like Cedar Point, like Lakeside,
Right.
like Sawmill Creek. And so I suggested that they put the word beaches in with a whole section on water activities. So it's in our draft, but maybe that's what the administration is doing, is they're looking at these different drafts and say, okay, well, that's in that one, so we can pull it out of this one. But
Right. If
the
you,
beaches are-
I was going to say, Larry, if you, I'm trying to decide if I can send that to you. I would assume that I can. I can send you the preliminary documents that we have on beaches, because beaches are separate from pools, obviously, but they're similar in like ponds and other lake frontage. So I could send that to you so you could take a look at it and see if you have any issues with it. And if you do, let me know, because we have another meeting Monday.
Well, if you feel you can, I don't want to infringe on your committee, but
Well, it's okay. I'll just tell them you stole it. You hacked my machine.
Everyone is aware we are recording, correct?
I am now.
So to the group at large, I did just launch a poll to you. I think what Jeff and Larry are discussing here is actually an important point, that things are going to be changing and being published pretty constantly over the next couple of weeks. We're excited to be getting more guidelines, but information will be changing. So make sure you're staying connected with the state's website and with your peers in the market. We would be happy to have another one of these sessions to get your questions and just provide some clear clarification, but would love your guidance on the timing of those, because we know everyone is getting busy reopening your businesses. So let us know what works best for you in terms of time and then cadence, whether we're looking 2 weeks or 3 weeks at this point, to make sure that there's been enough new developments to update you on and make it a valuable use of your time. So let me check here and make sure we didn't get any further questions in. And with that, we are over time here. So I want to make sure I get everyone out of here. Hold on 1 second. Just a comment from attendees that kudos to businesses like yours and Larry, to your organization for continually reinventing yourselves in some busy times and changing circumstances. So we're really excited to see Lake Erie Shores and Islands region powering back up. We know it will still be a beautiful place to enjoy in a lot of different ways. So thank you both for the input that you put into that.
Absolutely.
With that, I'll just thank everyone for their time today and close today's meeting. We will follow up with you about our next session based on your input here. Thank you, everyone.
Thank you. Good to see everybody.
Happy Friday. Enjoy your weekend.